Art therapy has been known as an effective way to heal patients and victims of disease, and it is used commonly. Art therapy is a fairly new method of therapy and has been around since the mid-20th century. It is still popular, though, and is used extensively. Art therapy helps by letting the user release their emotions through the mediums they use. This can be therapeutic, and it can emotionally heal the user, giving positive results. Through art therapy, we can heal others who are ill and try to help families who need it. Art therapy is an effective form of therapy, and by using it, we can create new ways to help others. Art therapy is the process of letting oneself express themselves on paper or any other medium. Drawing, painting, and sculpting are all examples of medium used in it. It mostly has positive acknowledgement and is known to be effective most of the time. Some therapists suggest that art therapy can heal many emotional wounds, such as the effects of war, trauma, and brain injuries. Art therapists have proven through studies that art can treat through releasing feelings through art, helping these people. This study dates back to 1971, where it was discovered that young adults under art therapy had positive impact on their self-esteem. However, some factors of the experiment proved to be impossible to tell whether the results were valid or not. They were not sure whether the art was the source of their boosting confidence or a different agent. Since then, there have been other studies on art therapy as well, in the fields of creativity, psychology, counseling, medicine, and others. In 2002, an experiment was conducted with heavily traumatized and disturbed children, hoping it would aid the children and become an effective treatment. They were able to see the differences with the children during and after the therapy, therefore proving the experiment to be successful. In another, during 2006, even though the group of people consisting of mothers and toddlers were not diagnosed with any mental or physical disorders, but the mothers had been experienced with death of a loved one. The interaction between the two showed that they became closer and had a positive experience, and the experiment proved that art therapy was successful. Art therapy is effective and can be used to help people with mental and physical diseases, and it can further treat the population. Art therapy should be studied more extensively, and it's still a fairly new addition to the medical science, and it still has many discoveries to be made too. Art therapy is effective one way or another and should be used more. A survey was conducted for this experiment with varied results. Most who took the survey were unaware of what art therapy was and had never performed it. Others who had experienced it said they had joined it and thought that it proved effective to them. The majority agreed participants in art therapy that had used clay as a medium for their therapy. A few stated they had done painting. When asked on whether they did art therapy for their own enjoyment or for helping a medical condition, 87% said they performed it for their enjoyment, whereas 12% had it for a medical condition. The respondents who did it for enjoyment have not performed it with the help of a medical professional. The majority of the respondents who had done art therapy said they had done theirs in a group, while the rest did it individually.
When I was doing my medical school in Karachi, Pakistan, I saw some people with some pretty chronic illnesses, with psychiatric illnesses, and that really bothered me. That affected me so much that I thought that I should go into that field. There are different kinds of patients with different issues, mostly for depression, for anxiety, to relieve their stress, to improve their social life, to express themselves a little bit better. Art therapy is very informative, and it's kind of a therapy that actually helps a lot for different kinds of issues. So I think that it is a really good, very nice kind of tool available to us. Effective. I think it's pretty effective if it is done in patients that are going into the treatment right away, because it helps them to loosen up, and then they start talking and they start communicating better through the art therapy. It is effective because that's how the people can express themselves. Their own feelings, their own thoughts are expressed through the kind of art that they do. So that's how we can recognize, we can identify what are the thoughts that they have, what kind of issues, the stress that they're dealing with, and then we can talk about those things that are bothering them. I think that I usually do the coloring, the picture, the drawing, expressing themselves through the different colors, and basically just expressing their own thoughts. So it's mostly the paper, the pencil, you know. But I'm pretty sure that there are different other kinds of art therapies also available that probably would be very effective as well.
Art therapy has been known as an effective way to heal the scars of numerous diseases, and it is used commonly. Is art therapy really effective, and can it actually make others feel better emotionally or even physically? Art therapy is very popular, and many therapists use it for patients. It helps by letting the user release their emotions through the medium they use. It is an intriguing form of therapy, and using it we can learn even more about the human mind and how it functions and heals.
So